Ay, na-note mo ba kung sino ang ating winner?
Pili tayo dapat actually ng kabataan. So mamaya na natin talaga i-flash to, partner, kasi talagang ang dami sa God. We'd like to request po na yung mga kabataan natin po ang sumagot, no? Tayo pong mga adults ay wag na po tayong sumagot. Alam ko po, we want to answer, no? Pero bigay po natin ang ating load to our kabataan partners here in the Zoom. So,
ayan,
ang dami nila kasi, partner. Ang unang-una actually ay taga DOH, so DNR and DOH, dole, ang ating mga partners dito. So, hindi ko alam pa paano natin anong tawag dito, i-sift through. Partner, what do we do here? Hindi mga partners natin yung nauna.
Sige ma'am, i-sift through natin later and announce natin, no, sa ating social media kung sino ang nanalo. And contact natin sila.
Opo. Yung mga young at heart, ayun, I love that. Yung mga young at heart, wag muna tayong sumali. No? Let us have really the young people join this contest. Sige po. Maraming salamat, partner. Let's just sift through this first. Wala daw kasi siyang pang-load. Okay, sige.
Congratulations po sa ating winner. Announce po namin mamaya. So, meron pa po tayong isang game. So, dito naman po, very simple lang ang mechanics natin. So, babasahin ko lang po yung statement. And identify nyo lang po kung ito bang statement na binasa ko ay myth or fact. Okay, Sir Ivan. Okay, so it says here, ang family planning ay masama sa kalusugan at nagdudulot ng cancer. Is it a myth or a fact? A timer starts now. Ayan, time's up. And the answer is, it's a pure myth po. So ang family planning methods gaya nga ng contraceptives ay hindi nagko-cause ng cancer at napatunayan ng ligtas worldwide, no? At nakakapagpababa pa ito ng risk na magkaroon ng cancer. So, Mamay, nakuha ba kung sino ang ating winner?
Okay, sige. Since mahirap i-sift through to, yung una na lang na nag-answer ang ating pipiliin. So, tama, hindi nakaka-cancer ang family planning. So, sa sobrang dami po ng nag-answer nito, ang unang-unang nag-answer ng myth ay si Christine May Balagot. Congratulations. Christine May Balagot, please message si Grace de la Cruz, nandito siya sa POPCOM, para ma-indicate yung prize mo. Thank you, partner.
Congratulations. Ayan, I hope you enjoyed our mini game break, and congratulations po sa ating keyboard warrior winners, no.
Yes, yung kanina, yung Pamilyang Planado Protektado, we'd like to congratulate from DOH Commits, si Ralph. Congratulations.
Ralph. Okay. Thank you, Mamay. So, at this point, let us call on the Partnership, Advocacy, Policy, and Communications Unit Manager of the Filipina Shell Foundation, Incorporated, Protex Global Fund, the HIV grant, Dr. Maria Stella Flores, along with her co-presenters, Ms. Elena Felix, founder and vice president of Association of Positive Women Advocates Incorporated, and Mr. Darwin B. Tenoria, project officer for PLHIV Filipina Shell Foundation, to dive into the role of family planning in addressing the HIV epidemic in the country, FP methods used by women living with HIV, and our call to destigmatize HIV among the PLHIV communities. Ladies and gentlemen, Dr. Maria Stella Flores, Ms. Elena Felix, and Mr. Darwin Tenoria.
Ayan. Yeah, okay, I'm already on mute. Good afternoon, everyone, to our distinguished guests, Yusek Perez, Mr. Kalyahan, fellow speakers, and everyone who is in this call. Good afternoon. I would be presenting to you the Protects Project of Filipina Shell Foundation. We are the primary recipient or principal recipient of the Global Fund HIV grant that will run from 2021 to 2023. This grant is aligned with the goals and objectives of the health sector's HIV strategic plan on 2020 to 2022. Our vision is zero infection, zero discrimination, and zero AIDS-related death. And the goal, of course, is by 2022, we would like to reverse the trend of HIV epidemic by reducing the estimated annual HIV infections to less than 7,000 cases. Next slide, please. Okay, how can we connect HIV program to family planning? We have identified the role of family planning in addressing the HIV epidemic in the Philippines as the key strategy to reduce the mother-to-child transmission. Family planning helps in preventing HIV infection in women. It will also help in preventing unintended or unplanned pregnancies among women with HIV, because this will substantially reduce the number of infants with HIV infection. We will also, family planning will also prevent HIV transmission from women to their infants and providing care, treatment, and support for mothers with HIV and children. So for preventing HIV infection, we will provide counseling and testing, provision of condoms, both for family planning and prophylactic reasons. We also have to do couple counseling to reduce the risk of acquiring HIV and sexually transmitted infection. For unplanned or unintended pregnancies, we have to provide women with HIV to choose a family planning method that is effective for them, considering all these minor side effects or the changes that they might encounter. Family planning will also prevent HIV transmission for women to their infants. This is what we call the vertical transmission. So this is occurring from the mother to child during gestation, delivery, and breastfeeding. What is our role here? We need to advise maternal testing because there is a prenatal ART. There will be treatments for mother and infant during their labor, delivery, and neonatal periods. There will be selections of the manner of delivery of during delivery, like if it's in cesarean or normal vaginal delivery, and identification if you are going to avoid breastfeeding. For providing care, treatment, and support for mothers with HIV and children, it is very important that we have to ensure mother's health and to protect the child's health and development. So papasok na rin dito ang ating mga support group. So for Protects, talagang tatlo ang specific natin. We have to ensure that HIV testing is part of routine pregnancy checkup, routine. Then we need to avoid a vertical transmission and normalization of HIV testing for pregnant women. This is normalization, voluntary but not mandatory. Next slide, please. Next slide. Okay, for family planning methods while on ART, for women living with HIV, it has always been with researches, studies, and a lot of interviews. They always provide us that when services are made available and accessible, many women with HIV use family planning. However, there are a lot of risks that needed special considerations. First, there is miscarriage and other complications. There is serodiscordant couples may consider the risk of transmitting the virus to the uninfected partner when attending conception. And then the couples may also need to consider how their health in the future may affect the child and think about the possibility of leaving a young orphan. So for Protects, we do this by having learning group sessions and focus group discussions. For healthcare providers and other in the Protects team, we should be able to provide couples counseling, should help women with HIV talk with their partner about contraception and the safer sex. And of course, providing the condoms for family planning and prophylactic uses, and provide information on HIV prevention. We need to ensure to them that for those who are women with HIV, they have to monitor their viral loads, their adherence to treatment, because U is equals to U. That is undetectable is equals to untransmittable. For the couples that may also consider how their health in the future may affect, there is a need for a healthy life and a support group. Kaya po andyan sina Ate Elena, ang ating women organizations with HIV, na talagang nandyan sila sa tabi natin, tumutulong. Support group po natin yan. Kumbaga sila ang sinasandalan natin pagdating sa usapang ganito. So, on our part, we need to enhance or heighten our HIV campaigns for enrollment to treatment, adherence to treatment, and of course, the U is equals to U. Okay, next slide, please. So the call to destigmatize HIV among PLHIV communities, us in Protects would like to uphold the RA 11166, which is the HIV and AIDS Policy Act of 2018. This is in Rule number 5, Section 25, preventing mother-to-child HIV transmission. Of course, our Department of Health already has established a program to prevent mother-to-child transmission. There is also the support of PMTCT that includes universal voluntary HIV testing, counseling, and referrals to HIV treatment and care. And the PLHIV pregnant women will have access to prenatal care, correct information, and the mode of delivery and newborn feeding to be provided by the attending physician and other health workers to prevent mother-to-child transmission. Our response here is, of course, there is a need for us to partner and collaborate with organizations to establish the services and the programs, either in the government sector, in the private sector, or community-based organizations, or champion individuals in reducing HIV stigma and discrimination. We will lobby for a regional and local ordinances against PLHIV stigma and discrimination, and the yearly data analysis on HIV stigma and discrimination. What is unique here in our Protects project for this grant is we have now a project officer for PLHIV. And we have here Darwin Tenoria, if you can share later on after our vision on what is your role as a project officer for PLHIV of Protects project. Next slide, please. So the vision of PSFI to help the country address the growing HIV epidemic. I would really like to quote our project officer for project officer for PLHIV community. His vision is to bridge the gaps of our country in response to HIV and AIDS. Him being the project officer, we completely understand and feel the urgency of our KPs and the PLHIV community, ensuring that treatment, health, and social services are being provided for those in need. Having an uninterrupted supply of life-saving drugs is vital. Being part of the vulnerable population, stigma and discrimination persists still in this time of COVID-19 pandemic. We would like to ensure that these concerns will be addressed as we continue our fight against HIV and AIDS and improve the quality of the life of PLHIVs. I love that line because nandun ang puso ni Darwin. So that's it for PSFI and the Project of Protects. I would like to give the floor to Darwin to share some experience on his role as a project officer of PLHIV community, and also to Ate Elena, representing the women living with HIV here in the Philippines and practicing family planning. Darwin, please.
Thank you, Doc Stella, and good afternoon, everyone. I'm Darwin Tenoria. I'm the project officer of Protects from Filipina Shell Foundation Incorporated. So as PLHIV, definitely po, Ako po isa rin pong may HIV for 8 years. It's my 8-year journey with HIV. But ang nakakalimutan natin, and since we are here in family planning, maraming salamat in tapping this particular topic, because it's not only the key population who are being affected by HIV, pero meron tayong mga marginalized sector ng lipunan na nakakalimutan, most especially yung ating mga kababaihan at ang kanilang mga anak. Kaya napaka-importante na mapag-usapan din natin ito, because these services are very vital din para sa kanila. As sabi nga ni Doc Stella this afternoon, we do have one of the women who is very empowering, and she herself able to foresee herself as a model woman for establishing her life as an HIV positive. Nay Elena, gusto ko rin pong magbigay ng sa inyo, ng pagrespeto sa hapon na ito, at maibigay sa ating mga manonood ngayong hapon. Ano ba yung journey ng isang kababaihan na merong HIV, at the same time, gaano ka-importante sa inyo yung family planning services na minsan ay hindi natin alam kung napagkakaiba or may kakulangan at kailangan natin punan. Nay?
Magandang hapon sa ating lahat. Ako ay nagpapasalamat sa Pilipinas Shell at sa POPCOM, at nabigyan kami ng pagkakataon na maimbitahan at makapagsalita rito. Siguro isa sa ay magpakilala muna ako. Ako si Elena Felix. I was diagnosed HIV positive in 1994, OFW po. Dati ay meron kaming grupo, yung Babae Plus, nagkaroon ng project ito under Global Fund. Ito yung PMTCT project for women living with HIV, wherein nakapag-handle kami ng 36 women living with HIV at nagbuntis. At luckily, lahat ng na ipanganak noon during that period ay ng project namin ay 35 ang non-reactive babies. So masasabi namin na antiretroviral treatment really works for women living with HIV, kasi nalilesen yung transmission from mother to child. So ilan na yung mga kababaihan namin na sigurado namin na nag-undetectable, ay na-enroll muna sa treatment at nag-undetectable, and then naswerte na hindi na ipasa sa kanilang babies. So mahalaking bagay. Isa sa component ng project ay yung family planning for women living with HIV. Maganda yung practice na yon, kasi naipakita rito na wala naman palang pagkakaiba ang family planning method sa general na aspeto ng family planning for other women's, na nakakaiba para sa women living with HIV. Ang importante lang siguro ay yung nasabi kanina na counseling, yung encouragement din ng mga support group tulad namin. Yung aming grupo ngayon ay ang Association of Positive Women Advocates Incorporated. Ito ay support group of women living with HIV. Sinisigurado namin ang aming mga member ay nag-a-adhere sa treatment. And then, isa sa mga issues namin ay ang family planning. Ano ba yung pinakamabisa para sa aming mga members? Kahit yung mga hindi pa namin members, basta na-reach out namin o nag-reach out sa amin, ay number one pa rin ay syempre yung condom use. Pero hindi natin masisigurado na gumagamit nga o yung mga partner ng aming mga women ay gusto ng condom. So ang isang sinasabi namin ay magplano ng family. Nag-try naman sila ng mga pills, pero dahil dun sa takot ng mga members sa pag-take ng pills at saka yung adverse reaction ng pills sa antiretroviral, parang mas tinitingnan nila ngayon yung pagpapatlang o yung yung calendar na old na technique. Pero sinasabi pa rin nila na mas mainam pa rin na basta nag-a-adhere sa treatment ay malilesen, Pero gusto rin nilang ma-emphasize na mas mainam pa rin meron tayong responsible parenting na learning group sessions among the support group. Bakit bakit kailangan ng pagpaplano? Kasi hindi maganda o hindi naman nakakaganda para sa isang women living with HIV na magkaroon pa siya ng extra burden. Isipin na lang natin na ang isang babae, merong asawa na pareho niyang HIV positive, tapos may anak pa, meron kaming member na dalawa yung anak niya HIV positive. Pero ganun pa man, meron din naman kaming mga members na ngayon ay nagkaanak na positive ang baby niya, ngayon ay adolescent na yung naging baby na yon, ngayon ay malapit na siya, nasa productive age na siya, no, reproductive age. So tinitingnan natin na dapat na ihahanda na rin natin yung ating mga adolescent na ito, mga adolescent living with HIV para doon sa kanilang pagpaplano ng pamilya. Mahalaga yung sinabi ng Filipina Shell kanina na dapat meron tayong mga focus group discussion, meron tayong learning group sessions para sa mga women living with HIV para naihahanda sila sa kanilang pagiging responsableng magulang, no? At sinasabi natin gusto natin makuha yung matiwasay, maligaya at malusog na pamumuhay, yung quality of life ng women living with HIV para naman maalis na kanila yung multiple burden na tinatawag, no? Kasi multiple burden, naalagaan mo na yung pamilya mo, iniisip mo pa yung mga gastusin, nandyan pa yung pag-take mo ng gamot at pag-take din ng gamot ng iyong mga anak o affected children. Isa rin doon sa tinitignan namin ay yung stigma against women living with HIV. Kahit naman sa people living with HIV, pero sa usapin ng pagpaplano ng pamilya ay malakas pa rin yung stigma and discrimination among women living with HIV. Noong panahon ko, noong 2007, nung nagsimula ako sa advocacy, hanggang sa 2015, iisang institution pa lang ang ating pinagre-refera ng mga nabubuntis, no, na women living with HIV, PGH pa lang. Pero dito pa rin naman nakakaranas ng diskriminasyon yung ating mga women na buntis. Dito yung pinagsisigawan na, ito yung may HIV, hindi ka dapat dito, doon ka sa kabila. Yung mga ganon. Pero dahil sa pagtutulungan ng mga CBOs, ng ating mga iba't ibang ahensya, ng ating Department of Health, ng PINAC, nagkaroon na ng maayos, no, meron ng Santa Ana nagbibigay na ng panganganak sa mga women living with HIV. Actually, ang Quezon City nagpaanak na ng normal delivery, no. Nasa World Health Organization naman guideline naman 'yon na basta nag-a-adhere sa treatment si women living with HIV at undetectable na siya, pwede na siya manganak ng normal delivery. Isa na lang sigurong problema na tinitingnan namin ay yung breastfeeding. Pero Darwin, sa ngayon, masasabi ko, meron ng 2 member ng aming grupo na pinag-breastfeed ng doktor nila doon sa yung kanilang mga babies. So sabi ko, magandang practice. So ako ay overwhelming yung mga ganong balita kasi masasabi kong unti-unti nawawala na yung stigma, no? Yung self-stigma ni babae na mahawa yung kanyang baby at saka yung stigma rin ng community, no? Kasi nung dati, kumpare ko nung bago ako sa community, ang pagtingin na may HIV ka, no, yung mga ganon, ay maihahawa mo agad sa baby mo. Tapos yung babae na may partner na non-reactive, mahahawa niya yung partner niya. Pero sinasabi ng grupo namin ngayon na talagang ang treatment, yung antiretroviral treatment, ay talagang maganda para sa mga people living with HIV kasi may mga member kami sa grupo na ilang taon na silang nagsasama without using condom ay hindi nahawa ang kanilang mga partner. So, siguro yung take on ko na lang ngayon siguro ay pataasin natin yung encouragement natin sa mga buntis, mga pregnant women para sa HIV testing, di ba? Yung kahit na ito ay hindi mandatory, pero mahalaga yung encouragement, yung counseling. Ma-encourage sila magpa-test para mahabol natin kung infected si mother, no? Kasi doon sa data natin, kadalasan, nauunang natetest yung ating mga newborn. Na sila yung muna yung nag-positive bago si mother, di ba? So, mas mainam na matest muna si buntis para ma-enroll natin sa treatment at masigurado na hindi mahawa si baby. So yun, masasabi ko
Elena?
yung, yes.
Yes, may question lang ako regarding dun sa ano, no? Pagdating dun sa pagpapatest, and we encourage all of the mothers na magpatest nga since ito naman ay nire-recommend. So, it's a voluntary pa din, pero we are highly recommending them to get tested.
Yes.
Pagdating po ba dun sa couple counseling, may maganda po kayang benepisyo to kung pares po si tatay tsaka si nanay yung magpapatest?
Yes, mas mainam pati yun. Kasi kung sa simula pa lang, malalaman na natin ang status ng couples. Malalaman natin kung sino sila kanilang dalawa ang positive, no? Kung si mother, at least ma-treatment na agad si mother. Kahit si tatay ang positive, maiiwasan na ma-transmit kay mother yung HIV. So malaking factor yon yung couples counseling na dapat ay talagang mai-consider na natin, no, na sa ating mga healthcare providers yung couples counseling for family planning at saka yung responsible parenthood, malaking bagay din yun. On stigma and discrimination, siguro masasabi kong 3 piece lang naman talaga ang kailangan natin. Walang pagkakaiba ang family planning method sa ibang mga kababaihan kumpara sa mga women living with HIV. Ang importante lang ay yung may choice si women kung ano yung makakabuti sa kanya. Tapos siguro isisingit ko na lang yung post-abortion management. Kasi meron tayong mga babae na hindi man natin gusto ay nag-miscarriage, no? Dahil sa stigma, parang na babawasan yung kanilang yung treatment ay hindi maganda. So, yung takot na magpa-check up, yung mga ganon. So, lalagay sa alanganin o sa risk yung buhay ni women living with HIV. Kahit na may treatment na siya. So, yun yung isa sigurong maano ko doon sa stigma and discrimination. Dahil sa mga bagong sinabi kong share ngayon ng aming grupo, ngayon may mga gumagamit na rin ng implant, no? Dahil mas gusto raw nila yung implant kaysa doon sa injectable dahil may konti mang mga side effect dahil nagte-take na nga silang gamot. Tapos yung pills din ayaw din nila dahil dagdag pa doon sa pasanin ng atay nila dahil may mga iniinom ng gamot. So parang mas gusto nila yung implant. So less na hassle, less na side effect. So tapos meron na tayong mga best practices, meron na tayong normal delivery. Dati cesarean agad yan basta HIV positive. Tapos ngayon meron na rin ng breastfeeding. So magandang mga balita yon para sa ating community. 3 piece lang naman yung iiwanan ko siguro sa ating audience para sa kapakanan ng ating community. 3 piece, unawain natin ang tungkol sa HIV at unawain natin yung mga taong nasa ganito kondisyon. Pagtanggap, hindi po madaling tanggapin, pero siguro isa sa ginagawa ng mga support group ay ma-empower yung aming mga members na tanggapin yung acceptance, yung tanggapin niya sa sarili niya yung ganitong sitwasyon, tanggapin siya ng family, tanggapin ng lipunan. Patas na karapatan, siguro masakit naman talaga yung ikaw ay maisantabi at ma-discriminate, lalo na sa mga healthcare services na kailangan, lalo na sa panganganak. So, karapatan nyo ay karapatan din naman namin. Yun lamang po, maraming salamat.
Thanks, Nay Elena. Siguro ako, Doc Stella, before ko ibigay yung microphone sa'yo, isa lang siguro, as the project officer for Protects, we're not only focusing on sa key affected population natin, no, yung sa ating LGBT community. Kasi meron pa rin mga part ng lipunan na talagang affected ng HIV, tulad ng mga kababaihan natin. These are the marginalized who are also need in care. Most especially nga ngayon, kaya pag pinag-uusapan natin yung mga women living with HIV, we have to strengthen din yung kanilang minimum service package na pwedeng i-offer ng ating mga facilities. Kasi pag babae yan, they're very vulnerable to na magbuntis. Kaya kailangan yung family services natin naka-in place din sa kanila. Because we have to educate them, to give them the right choices, at the same time, to help them to build a better family for better future. Yun lang yung take home ko for this afternoon. Doc Stella, balik po sa inyo. Thank you so much, POPCOM and DOH.
Thank you, Darwin, and thank you, Nanay Elena. So our our messages. Of course, we have to empower our women with HIV. They have a choice kung ano yung bagay sa kanila na family planning method. And we have to ensure that they will adhere to their treatment to avoid vertical transmission. There should be a support group and their access to services for them. We should not left them. No one is left behind in this campaign. Protex will cover this. Thank you very much. And back to your hosts. That's it for our part. Thank you.
All right.
Maraming salamat, Doc Stella Flores, Elena Felix, and Darwin Tenorio of the Filipina Shell Foundation. No, truly nga, no, as what Doc Stella, no, and Darwin mentioned, ang family planning ay isang key strategy para ma-reduce ang mother-to-child transmission of HIV. And syempre, sobrang ganda rin ng pag-share ni Ate Elena ng kanyang experience, no, as a representative of women living with HIV community and how family planning benefits them, no. At dahil nga, no, sabi nga ni Ate Elena, sa pakikipagtulungan ng iba't ibang players sa CSOs, government agencies, and other partners, no, syempre, unti-unti nating makakamit ang isang HIV-free Pinas. At ang tatlong bagay ng sinabi ni Ate Elena, kailangan lang po natin ng pag-unawa, pagtanggap, at patas na karapatan. Once again, thank you very much, Doc Stella Flores, Elena Felix, and Darwin Tenoria. Okay, partner. At this point, no, our colleagues from the Health Promotion Bureau of the Department of Health will shed some light naman and dive into the sub-theme natin on Usap tayo sa FP so you can practice safe sex. So I am glad to introduce my colleague who currently handles the HIV awareness and intervention initiatives at the Health Promotion Bureau of the Department of Health, while working, of course, as a communication specialist for the Filipina Shell Foundation HIV Global Fund grant. So upon receiving her master's degree in health communication from the State University of New York as a Fulbright scholar, Kling has worked in the areas of sexual and reproductive health, crisis communication, interpersonal communication, and gender and development. Ladies and gentlemen, our HIV communication campaign manager, Ms. Kling Malafo. Ms. Kling, over to you.
Hello! Maraming salamat, Kat. At masayang pamilya sa ating lahat para sa Healthy Pilipinas. Magandang hapon po. Maraming salamat sa pagsama sa amin dito ngayon sa aming event. So I'm just so excited to share with you our inspirations for our HIV campaigns in the Health Promotion Bureau, of course. Dahil naniniwala kami na may mangyayari, if we talk about it and if we use communication to sort of intervene the HIV issues that we have here in the Philippines right now. So for years, as we all know, HIV has changed the lives of so many Filipinos. Some have suffered the negative effects of discrimination, of stigmatization, and even bullying. Marami sa atin na nag-suffer dito. But some things have changed lately, and HIV is still undeniably present. Nandito pa rin siya. We haven't eradicated it yet. And the number of cases may be fluctuating at times, tumataas, bumababa. But there is us, diba? Sabi nga nila, merong tayo, the presence of organizations, of institutions in various sectors that actively engage with each other to help end HIV in the Philippines is a testament of hope. May pag-asa po. With us, HIV-free Pinas is of course possible, and we want to end HIV so badly in that in the near future, we won't be looking at the rising cases anymore, rather seeing real significant change as we slowly eradicate HIV. Sama-sama po tayo na malutas or masugpo na ang HIV sa bansa. One of the many ways, like mentioned earlier, to respond to HIV is through communication. Napag-uusapan nga daw lahat, di ba? At may magagawa tayo. We use various channels and platforms, of course, to reach out to our key populations. And the Health Promotion Bureau, with the help of our partners, is really committed to strengthen our HIV campaigns by looking at ways on how to effectively integrate HIV related issues in various health discourses. So we want everyone to be part of HIV-Free Pinas. Dapat tayong lahat ay sama-sama para nga sa HIV-Free Pinas. We can do this. In May, for example, we observed the AIDS Candlelight Memorial Day in honor of those who lost their lives due to AIDS-related complications. And that was also a way for us to make sure that no more lives will be lost due to AIDS. In June, we celebrated Pride as a protest to end HIV stigma, especially within the LGBT community, and to provide spaces and healthcare for everyone, regardless of SOGI or sexual orientation, gender identity expression. And now, this month of August, I'm just so happy to bring to you another level of HIV awareness as we integrate this into the whole concept of family planning, because we need to use really a holistic approach to sexual and reproductive health. And of course, HIV is part of it. Parte ang HIV ng mga programa natin sa Health Promotion Bureau. Next slide, please. Ayan, so we also want to champion inequalities. One of the identified barriers to practicing safe sex is lack of access to condoms, lack of access to lubes, and even information. So we strive to really strengthen our campaign to make healthcare that includes sexual and reproductive health services be accessible to you, regardless of your socioeconomic status, or your sector, or your SOGI, or whichever sector you come from. Lahat tayo dito ay sama-sama. Everyone is equal in health, and that is why there's universal healthcare. Universal healthcare helps us in pushing our advocacies forward, especially in our HIV responses, as they sometimes face a lot of inequalities and inequities as barriers. So sa HIV-Free Pinas, lahat tayo pantay-pantay. Katulad nga ng sinabi kanina ni Ate Elena, dapat pantay-pantay tayo sa ating laban sa HIV. Next slide, please. So we can end the HIV stigma by also acknowledging intersections. HIV is not only defined by its medical composition, rather HIV carries several issues in the cultural, social, and economic levels. HIV intersects with SOGI, may pagkakaugnay po sila, and family planning as well. Kasi if we box HIV within the idea that it is solely a sexually transmitted infection, we propagate stigma. Stigma is discrimination, actually, based on one's behavior, based on one's identity or disposition in society. It is also rooted in fear. Takot, for example, na baka mahawa, takot na tumulong kasi baka ma-associate sa community. But if we just acknowledge that HIV intersects with sexual and reproductive health and family planning in general, we take it out of the identities of the populations that are at risk of getting HIVs, like MSMs, men who have sex with men, transgender women, sex workers, people who inject drugs. These populations are identified by research to be at risk, but they do not in any way carry HIV as an identity. Tandaan natin lagi na HIV is a chronic condition. HIV is not a name. HIV is not an identity. HIV is not a character, and more so, HIV is not a person. Next slide, please. So we also want to step up our HIV response by upholding the rights of the PL-HIV communities and us in general, like what mentioned by Dr. Stella earlier. So claiming our rights means giving justice to our existence. Meron tayong Republic Act 11166 that shields the PL-HIVs against discrimination sa lahat ng levels po, workplace, school, even healthcare settings. It also pushes for the implementation of HIV-related programs here in our country. The Health Sector HIV Strategic Plan of 2020-2022 was also developed to ensure sustainability in all of our HIV-related programs and campaigns. So HSP, yung tawag natin doon, takes HIV and the campaign and service provision levels so seriously. And next slide po. So, paano naman natin ngayon i-relate yung HIV-free Pinas sa broader vision ng Healthy Pilipinas? All of our HIV campaigns in the Health Promotion Bureau are informed by the broader vision of Healthy Pilipinas and Consultayo. Healthy Pilipinas, of course, motivates us to use a whole of society approach in HIV intervention. That is why we engage partners to harmonize and align their campaigns with us so that we are one in making HIV-free Pinas happen. Kaya nga talaga natin to. And along that line, our branding is also aligned with our partner. Special mention really to hashtag #OurSafely. Follow niyo po sila ha, sa Facebook, Instagram, Twitter, kami din. Healthy Filipinas Facebook, where we both promote sex positivity while ensuring that HIV-related services are delivered to the key populations effectively in virtual and face-to-face settings. So lahat nga talaga tayo mag-out safely for a healthy Pilipinas. Ayan. And since we want to strengthen our relationship or the relationship of our clients with our healthcare partners from the community levels and up, there's Consultayo that guides the direction of our demand generation initiatives. Meron din tayong Consultayo sa online beshies kung saan pwede tayong magtanong patungkol sa HIV-related services o ano bang mga impormasyon na gusto nating malaman patungkol sa HIV. And we assure you that we are doing our best really to increase our condom use, especially among key populations, to increase the number of people who get tested for HIV, to increase ART or antiretroviral therapy adherence, and change, of course, the social perception of HIV to end stigma. Gaya nga sinabi ng mga previous speakers natin kanina. And we really want to appeal to parents and educators and teachers in general to normalize the discussions on sex and sexual and reproductive health. Let's all push for comprehensive sex education, mga kapatid. And we have also developed the HIV Adaptive Plan together with our partners, both internationally and locally, to ensure the delivery of HIV-related services now that we are facing COVID-19 pandemic. So, minimake sure po namin na yung mga serbisyo na yan ay patuloy pa rin na tumatakbo despite all the lockdowns and the quarantine restrictions that we are facing. And lastly, yun nga, mag-usap talaga tayo patungkol sa HIV. We hear you, nakikinig kami sa inyo. Magtulungan po tayo dahil hindi kayo nag-iisa sa laban upang masugpo ang HIV. Kaya tara na mga kaibigan, sa HIV-free Pinas. At lagit-lagi, permigid, dumdumon ninyo, dumdumon natin, lahat tayo padayon para sa isang healthy Pilipinas. Thank you so much, everyone. And magandang hapon po ulit. Over to you, Kath and Bamay.
Very much, Ms. Kling Malaco, our HIV Communication Campaign Manager. And then, para makamit nga natin ang vision natin na isang healthy Pilipinas, we make HIV-free Pinas happen, as mentioned by Kling, by recreating the narrative of HIV in the country. Sabi nga ni Kling, tatlong pamamaraan, inclusivity, localizing approaches, and destigmatization. Again, maraming salamat, Ms. Kling Malaco. And now, at this point, to present the Health Promotion Playbook on Sexual and Reproductive Health called the KADA Network, we are joined by Ms. Dasha Uy, Health Program Officer at the Department of Health, Health Promotion Bureau, Program Implementation and Outreach Division, where she handles portfolios related to active transport, healthy diet, and sexual and reproductive health. Dasha graduated from Ateneo de Manila University with bachelor's degree in AV Diplomacy and International Relations and AV Communication Journalism. Ladies and gentlemen, our Health Program Officer, Ms. Dasha Uy.
Hello po, magandang hapon everybody. Kath, can I be heard clearly?
Yes.
Okay, great. So I'm very excited to be here today and to be able to present to you some of the Health Promotion Bureau's work. So Kath, next slide please. Ayun po, yung ipapresent po namin today ay ang ating mga Health Promotion Playbook or the local health promotion playbooks, no? So itong mga playbooks na to ay are guides, no, for our local government units to be able to implement health promotion interventions for the 7 priority areas of the health promotion framework strategy, no? So for 2021, we have 8 playbooks in total. Dalawa po for priority area number 1 on diet and physical activity, and then 1 each for the remaining 6 priority areas, no? So our remaining 6 priority areas are environmental health, immunization, substance use, mental health, sexual and reproductive health, and violence and injury prevention. No? So for today, we will be talking about the Key Assistance for Developing Adolescents Network, or yung KADA network po natin, no? Yung playbook natin for sexual and reproductive health. So kami po sa Program Implementation and Outreach Division, can you please go back to the previous slide? Bakit po natin to ginawa, no? Because we want to acknowledge the very important role of our local government units in being able to implement, no, yung mga health promotion interventions. At nakita po natin yung yung pagiging importante po ng ating mga local government units, no, in for example, COVID-19 response, and even in the future, no, as we continue to devolve health, the role of the local government units will continue to get bigger, no? So we want to continue to be able to build capacities for our local government units and for our local counterparts to be able to make environments that make the healthy choice the easy choice, no? So part of this is our local playbooks po, no? So ano pong linalaman ng each of the 8 playbooks that we will present, that each of the 8 playbooks that we have created for this year? Next slide, please. So each of the 8 playbooks, as we said earlier, is an all-in-one guide po. So ibig sabihin po, from start to finish, meron na po siyang components, no, for local government units to be able to roll out their own health promotion interventions. So including po yung KADA network, no, from start to finish, yung nilalaman po ng playbook ay unang-una yung evidence brief. So what does the evidence brief contain, no? The evidence brief contains ano po yung problema, ano po yung magiging intervention, and why does the intervention work, no? And more importantly, why do we have to direct attention towards the problem, no? And we wrote this evidence brief specifically so that our local counterparts, our health officers on the ground, health promotion officers, are able to pitch their ideas to our local chief executives, no? Tapos, next naman po, we also have a template policy. So yung template policy po, usually that comes in the form of an ordinance, no? So kumpleto na po yung ordinansya from start to finish. Yung kulang na lang talaga is ilalagay po yung pangalan ng local government unit, or i-edit-edit na lang ng konti. Depende po sa konteksto ng ating mga local government unit. Pangatlo po, meron pong implementation checklist. So dito po, bine-breakdown na po natin, no, yung implementation ng health promotion programs natin by tasks. So yung kulang na lang talaga na pwedeng gawin ng local government unit is to insert na lang sino po yung in charge, kailan po siya gagawin, at ano na po yung magiging status of implementation, no? So one by one na po siya, nakalista na po siya kung ano po yung nilalaman ng ating implementation checklist, no? Next, we also have our basic resource requirements. So madalas, no, iniisip kasi pag health promotion interventions, konti lang yung pera na kailangan dyan. Kasi usually yung iniisip po natin IEC materials, yung iniisip po natin campaign. But that's not necessarily true. No? When we talk about health promotion, it's not just about promoting individual behaviors. It's not just about our communication campaigns. It's also about creating environments, or harnessing people and partnership, no, to get together to be able to create environments that work for health, no. So in as much as yung individual, pag hindi natin sila pwedeng sabihan, no, na parang be healthy if hindi nila alam yung mga behaviors na kailangan nila gawin, the same can be said also for their environment, no? So if their environment is not conducive for them to be able to act on these healthy behaviors, no, then hindi talaga po sila magiging healthy, no. So that's why we have to invest in health promotion, and that's why we have this basic resource requirements here, no. So yung basic resource requirements po, nakalista na po doon what the government would need to spend on to be able to launch a certain health promotion intervention, no. So this will help our local governments not just in being able to estimate how much they need, but even in planning for future years, no, for sustainability of our health promotion interventions. So in addition to that, we also have our capacity building requirements. So again, as we said earlier, no, yung health promotion po is no longer just the responsibility of our health promotion officers, but it's really a partnership between our health promotion officers and many, many different sectors. No, you can take, for example, yung playbook natin dito sa sexual and reproductive health. Sexual and reproductive health is not just the responsibility of our health officers, but it's also the responsibility of our population officers, of our sanitation officers, of our teachers, of our social welfare officers. So all of these people in the local government and in the national government have a role to play when it comes to promoting adolescent sexual and reproductive health. Which is why it's important na nabibuild yung capacities ng mga iba-ibang sektor, no, so that they can be able to effectively implement health promotion interventions, no, and effectively respond to the needs of our vulnerable sectors, including our adolescents. We also have a communication plan. Siyempre, no, hindi naman to nawawala sa ating mga health promotion interventions at kumpleto na po yung ating health communication plan na kasama dito sa health promotion playbook. So ano pong ibig sabihin ng kumpleto? Ibig sabihin po na outline na po namin kung sino yung target audience, na outline na po namin kung sino yung behavior, kung ano po yung behavior at communication objectives. Nalagay na rin po namin kung ano yung mga key messages. And then we also have materials which are actually ready to use and already easily downloadable, no, by the local government unit so that they can edit and they can print out these IEC materials. And in addition to IEC and campaign materials, we also have community activation ideas. No? So it's not enough to just post yung ating mga posters. It's not enough to just blast on social media yung ating mga social media cards. No? We also have to be able to activate the community, to be able to get the community to be involved in the health promotion intervention, no? Which is why it's so important that our communication plan is followed also. Fine, next to the last, we also have our monitoring and evaluation. So dito po nilalagay na po namin yung indicators, no, for success of the program. And last but not the least, syempre meron kang frequently asked questions para din madali gamitin yung kada network playbook natin. No? So we want to get into the meat of what the kada network playbook is. Next slide, please. So bakit ba natin to ginagawa? No? Why should we focus on adolescent health? Unang-una, at na-mention na po natin kanina ng Executive Director ng POPCOM din, no, na nakikita natin na there are rising sexual and reproductive health issues among adolescents. And this is attributable to many different things. No? It could be legal barriers na hindi pa sila pwedeng kumuha ng contraceptives sa ating mga health centers. It could also be social barriers. No? So maraming stigma, discrimination involved when adolescents talk about sex. Parang iniisip natin, ay, bata ka pa lang, dapat hindi mo yan pinag-iisipan. No? But actually, there are many things about adolescent sexual and reproductive health that are useful to learn, not just to prevent sexual and reproductive health issues, but also for them to become well-adjusted citizens in the future. No? So ano yung mga rising sexual and reproductive health issues na nakikita natin? Nasabi na kanina, no? Unang-una, there is low health literacy. So yung mga adolescents mismo, hindi nila alam kung saan sila pupunta, kung anong kailangan nila gawin, dahil nga there's a lot of stigma. Pag tinanong pa lang nila yung, I don't know, teacher or parent, minsan sasabihan pa sila na parang, huy, dapat hindi mo yan pinag-iisipan. So of course, they will not know what to do in case that there is a sexual situation, no? And so as a result of that, we see that there are increasing rates of adolescent pregnancy. There's also increasing rates of HIV infection among our young people. And as said earlier, no, marami ding sexual abuse. So actually among those who are, among the adolescents, no, who are pregnant, many of those are pregnant because their partners are much older than them. No? So nakikita natin there could be sexual abuse in some of these situations as well. No? So again, increasing rates of adolescent pregnancy, increasing rates of HIV infection among our youth, and increasing rates of sexual abuse. Mas lalo-lalo na ngayong COVID. No? So we are expected to see rates of these three issues continue to rise as the COVID-19 pandemic continues. No? And again, research and implementation has shown both here in the Philippines, no, and abroad, that adolescents are capable of responsible decision making. Kayang-kaya nila yon. Basta, ano kailangan? Unang-una, reliable knowledge. Pangalawa, good guidance and support from trusted adults. No? So madalas iniisip natin na, oh, you shouldn't be thinking of that. talking about sex with young people, with adolescents especially, will encourage them to experiment, will encourage them to have sex with their peers or with people who are older than them or with people who maybe they don't know, no? So risky sexual behavior. But actually, our research and our implementation has shown otherwise. The more that you educate our adolescents and the more that you are able to provide them complete information, the less that they engage in risky sexual behavior. So ibig sabihin, bumababa po yung pag-experiment nila. Why? Because they no longer feel the need to experiment. Dahil, ay, sinabi to ni mama sa akin, pag nag-sex ako, okay, masaya siya, pero there's also a possibility that I could get pregnant. So what can I do to protect myself? No? What can I do to prevent adolescent pregnancy? What can I do to prevent HIV infection? What are the signs of sexual abuse so that I know what to do? And then from there, adolescents are able and capable of making responsible decisions. So yun ang pinapakita natin over and over sa mga research natin, sa mga implementation natin, worldwide and here in the Philippines. And last but not the least, syempre, yung attitudes natin towards adolescents can make or break adolescent health-seeking behavior. And this goes not just for our community frontliners, but for all of the adults that adolescents trust. So siguro yung top 2 na tinatrust ng mga adolescents when it comes to SRH are unang-una, their parents, syempre, they want to be able to talk to their parents. And pangalawa, yung community frontliners natin, yung mga health workers natin, yung mga teachers natin, who adolescents trust. And very, very important sa kanila yung attitudes ng ating mga parents, ng ating mga community frontliners when we are talking about sex with adolescents, or when we are talking about sexual and reproductive health with adolescents. Kailangan very patient tayo, kailangan very respectful tayo of their needs. The moment na may pinakita tayong konting stigma, the moment na may pinakita tayong konting, you shouldn't be thinking about that, you shouldn't be talking about that, mas natatakot na yung mga adolescents. And when they get scared, and when they feel like they are being stigmatized against, or when they feel like they are being prevented from getting the information that they need, then they will look at other sources na. And itong mga other sources, those are potentially dangerous sources na, kasi hindi naman tayo sure, kunyari sa internet, kung tama ba yung natututunan ng ating mga young people, ng ating mga adolescents. So it's very important that our parents and our community frontliners are able to speak with adolescents in a way that they can understand, and at the same time, in a way that makes them comfortable. So ano bang nilalaman ng kada network playbook? Next slide, please. As we said earlier, it has the 8 components, but specifically the kada network creates a network of multi-sectoral partnership and collaboration between different sectors in the local government unit. As we said earlier, this is no longer just about the health office or the health sector, but it's really also about our social workers, it's really also about our teachers, our educators, it's also about our parents, the religious sector. All of these people have to get together and be able to speak about adolescent sexual and reproductive health to our adolescents. So to be able to address this, we put together a network of all of these people. Dapat nag-uusap-usap sila, to establish the KADA network, or the Key Assistance for Developing Adolescents Network. So we expand on the concept of the adolescent-friendly health facilities para mas dumadami po yung sector na kasama dito. So as we said earlier, it's not just the health sector, but the social worker sector, the education sector. All of these people have to come together. And we want to reorient adolescent sexual and reproductive health services to be able to create a community-based team that is ready to serve our adolescents. So we go back to the 5 action areas, or the 5 priority areas of the Ottawa Charter for Health Promotion. So again, as we said earlier, it's no longer just about the IEC materials. It's no longer just about the campaigns. It's no longer just about developing personal skills, but it's also about building healthy public policy. It's also about creating supportive environments, strengthening community action, and reorienting our health services. So the KADA Network Playbook has portions that attest to that are funneled into each of these action areas. So for building healthy public policy, as we said earlier, there is a template ordinance that formalizes the local government unit team of pro-adolescents. Kasama na po dun yung roles and responsibilities ng KADA Network. Kasama na po dun yung what they have to do in each meeting, what they have to provide for in terms of services and in terms of attitudes. In terms of creating supportive environments, not only do we increase the number of facilities so that adolescents have more access to these services, but we really want to talk about the way that we approach our adolescents. No? So in terms of strengthening community action, again, we are expanding the number of sectors who are involved, but at the same time, we are making sure that the number of sectors who are involved are also capacitated and are also knowledgeable on being able to be adolescent friendly, on being able to respect adolescents where they are, no, on being able to tell adolescents, you can come to me if you need anything. I will be open. I can be honest with you, and you can be honest with me as well. No? And we can talk about your concerns together in a way that doesn't make you feel judged or stigmatized. No? So when we talk about developing personal skills, it's not the personal skills of the adolescents, it's the personal skills of those who are speaking to the adolescents, so that the adolescents feel comfortable when talking to people who in the community who matter. No? And last but not the least, syempre, reorienting health services. We want to address the barriers contributing to the hesitation of teens in seeking out services. So alam na po natin, no, meron ng services on the ground for our adolescents. Meron na tayong mga adolescent-friendly facilities. Pag pumasok ka sa ospital, dapat, no, there should be section for our adolescents. No? There should be teen-friendly spaces for our adolescents as well. But why do the teens not want to go to these services? Kasi nafe-feel nila na nasa-stigmatize sila, nafe-feel nila na natatakot sila, hindi sila sure kung ma-judge ba sila. So that's what we want to address. No? We want to address those barriers. We want to make sure that our health officers are well adjusted, no? And are able to address the needs of our adolescents. So yun po yung nilalaman ng kada network playbook. No? So again, from start to finish, we are setting up that network and we are making sure that our local government units are capacitated. So before we end this presentation, no, I just wanted to share to you some samples or yung mga implementation na nagawa na before that shows, no, how we are able to operationalize yung kada network playbook. No? So I wanted to share with you isang case study galing sa Iloilo City on comprehensive SRH case management. No? So yung sa Iloilo City po, we see that there is a partnership model of service delivery. In the same way na yung kada network, ine-expand din yung mga sektor na kasama sa addressing adolescent SRH. We also see that in Iloilo City. No? So sino po yung involved? Yung local government unit, yung civil society organizations, and at the same time, very important, yung adolescents. No? So what did Iloilo City do? They made sure that their services are adolescent friendly. They took into account how do we reach adolescents so that they are aware of these services. No? They also took into account how can we be more adolescent friendly so that our adolescents are more comfortable reaching out to us. They also took into account the need for confidentiality. No? So syempre yung adolescents minsan nahihiya pa sila. So of course you'd have to keep their secrets also pag lumapit sila sa inyo. So that partnership model of service delivery in Iloilo City na medyo matagal na actually, no, I think they started in 2015 or 2016. Nagkaroon na ng maraming results. Primarily they focused on HIV. So marami silang adolescents living with HIV na nahanap, no? And because they were able to track and find these adolescents living with HIV, they were able to provide these adolescents with medical, social, and economic assistance, no? At na-reintegrate po itong mga adolescents sa kanilang mga pamilya and sa kanilang mga peer groups. And not only that, it's not just about HIV, no? Pero nakikita natin when we talk about adolescent sexual and reproductive health, it's really for everything. So pati yung teenage pregnancy nag-decline din in the city, no? So after we produced the kada network playbook based on itong mga case studies such as the one in Iloilo City, no, we started piloting it na rin. So yung pilot site po natin ay yung province of Samar po, and we are very, very proud of them because they're very, very creative in the way that they are able to implement the kada network playbook. No? So they have a project called Sirak Kabataan po. No? So it's the province's youth-led response to all youth-related concerns. So kasama po dito, again, multi-sectoral, yung health, yung education, yung security, etc. No? So yung kada centers po natin may integrate dito sa mga purple desk ng Sirak Kabataan. No? So yung purple desk po natin, they are run by adolescents and they will be catering to adolescents. No? So yung Sangguniang Kabataan po, yung nagli-lead the way with regard to this. No? So again, the response to adolescent sexual and reproductive health issues is youth-led, it's youth-friendly, it's very youth-responsive. No? So the province of Samar is currently in the process of training kada network frontliners, no? From the health, social welfare, and youth sectors. No? So they can be equipped to join the kada network. No? So yun yung ginagawa ng province of Samar ngayon. And we're very, very proud and we're very, very excited to see where they continue to go on this journey. No? So I saw dito sa chat earlier that there were people who asked for the link of the playbooks. Next slide, please. You can actually access our playbooks, all of our playbooks at this link that's flashed on your screen now. It's bit.ly/HPB_2021 playbooks. Again, that's bit.ly/HPB_2021 playbooks. Or pwede nyo pong i-screenshot itong slide natin ngayon, no? If you have any questions, if you have any concerns, or if you need help with regard to rolling out the playbook in your own local government unit, kami sa Program Implementation and Outreach Division, we are always happy to help. You can reach out to us po at piod@doh.gov.ph. Again, that's piod@doh.gov.ph. Iiwan ko po yung email namin dito sa chat po. So thank you very much for listening. I hope you learned something from our presentation today. Babalik ko na po yung floor kay Kath.
Thank you, Dasha. So sabi nga ng participants natin dito, no, Dash, kailangan pa natin ng mas maraming Dasha sa ating campaigns and community activations, no? So truly, no, this key assistance for developing adolescents or the KADA network playbook, no, would be very helpful sa ating local government units dahil sabi nga ni Dasha, nandito na nga yung ready-to-use tools and guides ng ating para sa ating LGUs, no, to promote community support to adolescent sexual and reproductive health. And ayan, marami ring nagtatanong at nanghihingi ng copies ng playbook. So nabanggit na rin po ni Dasha yung link. Pero of course, we will send po sa inyo along with the presentations and recording of this event. So again, thank you very much, Dasha Uy. Okay, partner Mai.
Ayun, maraming salamat. Yes, partner. So we've come to the point of open forum. So maraming salamat kay Dasha, the rising star of DOH, sabi ng ating mga participants dito, no? So we'd like to encourage ang ating mga kabataan and ating mga stakeholders and those watching all of our online platforms to use the chat box, and if you want to unmute yourselves, you can raise your hand so you can be recognized. All right, and you can open your cameras for your questions. All right, so ang una nating question, sabi kanina ni Christine May, kapag po yung lalaki naman may HIV pero matagal na nagagamot and yung nabuntis ay negative naman sa HIV, posible bang maging HIV positive yung baby? So we have our FP experts here. So nandito naman si Doc Jan, nandito si Miss Kling, nandito si Dasha, no? And our partners are Filipina Shell Foundation, dyan din si Ms. Elena, si Sir Darwin, who can help answer all our questions. Of course, nandito din naman si partner Kat, who can also answer. No? So, andito muli ang ating mga experts. Is Doc GP still around? Okay, so andito naman ang aming Deputy Executive Director, Boyanta Cardon, who can answer your question from POPCOM. Again, ang ating mga experts, no, ay nandito. Doc Jan, si Dasha, si Ms. Clay, alright, and taga-Filipina Shell Foundation. Okay, so who can answer this about HIV? Yung lalaki matagal na daw nagagamot ng ARV, pero nabuntis ay negative naman sa HIV. Posible ba maging HIV positive yung baby? And then also, bago natin sagutin yan, yung kanina may nag-ask kasi about pills safety for persons living with HIV according to our FP experts na si Dr. John Llevado. Alright, ang pills po ay generally safe for persons living with HIV. So we don't need to worry. If you are taking pills and you have HIV, don't worry because it's safe for you. All right, and we want to also drive home the point po that there's still a need for us, diba, Miss Kling, for consistent and correct use of condom so that we can avoid HIV. Yung pa din ang ating core message sa ating lahat. And we still are for modern family planning methods, no? So ang ating mga traditional family planning methods like calendar, rhythm, withdrawal, those are not really endorsed kasi modern family planning methods pa din talaga. We have, of course, ang ating mga long-acting and short-term methods and also scientific natural family planning. Okay? All right. So let's maybe Kling, you can answer that. Can it be passed daw sa DB?
Hello, Mamay. And of course, dun sa nagtanong, kapag yung isang tao ay naka-ART, I think install your internet ko, sorry. Pag yung isang tao ay naka-ART at may adherence naman siya, so titignan mo yung viral load. So kapag sobrang baba ng viral load, meaning untransmissible na yung HIV sa asawa niya or sa ibang tao, like what Doc Sala said earlier, U is equal to U. So kapag undetectable na yung viral load sa katawan ng isang tao, meaning hindi na siya ma-transmit sa iba pa. Right, Doc Stella?
Doc Stella?
Yes. In the case dun sa nag-question, we call that as zero discordant couple. So the male is positive for HIV and the partner is negative, and then hindi na infect ang partner or there was no infection sa baby. So it means the pill HIV or the person living with HIV has already a very low viral load count. So most probably that person is already undetectable. So there is really a message here that if you are adherent to your ART treatment and your viral load will be undetectable and you cannot transmit the virus to your partner. Yun po yun.
Thank you very much for clarifying that, Dr. Stella and Ms. Kling. No, actually, meron pang clarification and additional rejoinder si Doc Jan about the pills. No, of course, if you are a PLHIV, you have to consult your infectious disease specialist. If you have any concerns, nonetheless, pills, COC, and POP are generally safe pa din talaga, okay, to be used by persons living with HIV. All right, we have Doc Emma Lianto asking what are drivers of increasing HIV infection among young people? Very, very critical question that all our young people here should really know. I think it's a programmatic question, no? Maybe Kling?
That you may answer that question.
Certainly po. Once and for all, yung ating challenge with regards to the increasing rate of our young kid population, ages 15 to 24 years old, tumataas talaga. Because primary, hindi ganun ka-strong yung ating sexual education sa ating mga schools. We must have to develop all of this kasi at this particular age they are exploring, actually pabata ng pabata, working in the HIV program for several years. Parang nag-start ng 16 nung before, pero ngayon we are seeing trends that younger individuals are getting involved with sex, even 12 and 13 years old. And every time that we are do some school dissemination campaigns and do some FGDs with them, tapos pag nag-go one-on-one na, we are hearing some anecdotal stories even at 12-year-old and 13-year-old. So nakakatakot kasi if this is the current trend that the youth is into, what's the government and the other stakeholders need to do? Diba? Kasi it's a rapid siya eh. Mabilis talaga siya. Lalong-lalo sa kabataan. And we have to act fast. We have to, as a project officer siguro, yun yung magtulong-tulong tayo, not only for education, but also for formulation kasama ng mga parents because education starts at home. Kapag hindi pinag-uusapan ito sa loob ng bahay, hindi kasama si parent pinag-uusapan ito, it will not be a success story kapag walang kasamang gabay ng magulang. It's not only the government, it's not only the education system, it's not only the health. Kailangan it's a multi-sectoral approach in terms of educating our youth. So that's my point po. Over.
Very well said. Tama. It should be a whole of government approach, no, in education. So, programmatically, maybe someone from DOH can answer what are the drivers of HIV infection among young people.
Hi,
Yes.
Mamay.
Yes po.
Sige.
Dasha.
Sino ba, Kling? Sige, ako na lang muna. I just wanted to echo PSFI's point, no. Yung data talaga will really show us na early initiation to sex, no, mas maaga nagsisimula mag-sex yung mga bata ngayon. And yet, late yung education about contraception, late yung education about how to protect yourself. No? So again, as Sir Dar said earlier, as early as 12, 13 years old, nagsisex na sila. Pero yung education about contraception and how to protect yourself will come later pa, usually mga 18, 19, or later pa, no? When they've had sex for many, many years already. No? So there's a big gap during that time ng 7, 8 years where they don't have any protection, and that can really lead to not just HIV infection, but teenage pregnancy, bad relationships, abusive relationships, no? At bakit nag-early initiation yung mga bata, no? I think popular belief will tell us na, ay, hindi, galing yan sa media or galing yan sa bad influence or whatever, no? But that's not necessarily true. What we do see, some of the drivers, no, for early sexual initiation are violence and sexual abuse at home. It could be that, no? And again, as Sir Dar said earlier, no, not speaking about sex accurately at home. So yung napupuntahan ng mga bata na sources, yung internet, yung kanilang mga peers, na not necessarily totoo yung mga sinasabi doon, no, or accurate yung mga sinasabi doon. Very important yung parental guidance or yung guidance of somebody who they trust. It could even be a teacher, it could even be yung health officer sa school or sa LGU. No? What's very important is that our young people and our adolescents are getting accurate information from a young age, from as early as 12, from as early even as 10 or 9, dapat they're being taught already about their body, about what is comfortable, about consent, about all of these things, no, so that we can prevent early sexual initiation. Our research actually shows that the earlier and the more that we are able to talk about sex in an age-appropriate manner, the less that young people are able to, no, engage in risky sexual behavior, and that includes early sexual initiation. So young people who are able to get the guidance and the information that they need actually have sex later in life also. Kling, maybe you have something to add?
Yeah, I really agree with you. And based on the current data that we use to develop the HIV strategic plan, nakita po talaga namin na may condom lag. Based din siya sa National Condom Strategy Framework natin. May condom lag between doon sa first time na nakipagtalik yung isang bata at saka doon sa unang pagkakataon na gumamit siya ng condom. And sometimes it's just too late. Diba? Nagkaroon na ng infection or na-engage na siya sa unprotected sex. Kaya, like what Dasha said earlier, it is really important to push for comprehensive sex education because sometimes parents are not comfortable talking about sexual and reproductive health issues at home, 'di ba? So, saan natin kukunin yung information natin, 'di ba? So sa school, 'di ba? Or sa mga communities natin, mga health workers natin for that matter. Kasi pababa yung sexual awakening ngayon 'di ba? Hindi siya nagsa-start at 15, yung iba 11, 'di ba? May mga research na nagsasabi na 10. So dapat i-address natin yung mga gaps na ito.
So, maraming salamat. Actually, I can call on also POPCOM Deputy Executive Director Boyd Takardon kasi may question na related there about sexuality education at this time in the Philippines. Sir Boyd,
yeah. Hello, masayang pamilya sa ating lahat. Our resource persons have rightly said talaga that the importance of comprehensive sexuality education, and that's the main message actually of today's activity, and to really encourage everyone not only to voice out but also to seek information needed for their in the management and in having more responsible sexual behaviors, lalo na sa mga kabataan natin. And it all boils down doon sa ating empowerment and enabling young people to with the necessary information. And we've seen that the family planning is indeed very, very broad and very broad and encompassing talaga, which include yung mga usapin ng mga HIV. So that means the more that we have to really push for interventions that increase yung opportunities for all of us, lalo na sa mga kabataan, to access the needed information. So that's why the call for today's activity is for everyone to participate in broadening yung information that we can give to our young people and of course to our family, to our couples.
Okay, broadening information and access to information. Yes. So, may question pa din po related to HIV. Maybe asked from DOH, from LGU Panabo City. A list of FP methods that are safe for ETL-HIV, especially for women. So maybe may list daw po ba tayo ng mga safe and effective methods for PL-HIV? Who wants to answer po from DOH?
Hello, Ma'am
Okay.
Mai. I'll answer the question po.
Yes, please.
So ngayon po, ilalabas natin yung HIV Adaptive Plan. And kasama po doon yung list ng hubs at list naman nung mga safe and effective methods sa family planning kasi nag-i-intersect po sila doon. So hintayin lang po natin, ipapromote po siya natin sa Healthy Filipinas page. Ayun.
Maraming salamat. Sabay pa tayo nag-ayun. Sige, ito naman. RPRH law does not allow minors to access contraceptives without parental consent. This is very restrictive. Is there a move to change this provision? Okay, so it's about the RPRH law and the minors access to contraceptives without parental consent. So may move na ba daw tayo to change and campaign for the amendment of this provision? Who wants to answer po? Okay, Doc Jan. Sige, Sir Boyet.
Yeah, that's actually one of the perennial concern nga natin since the enactment of the Responsible Parenthood and Reproductive Health Law, lalo na with the ruling of the Supreme Court to require parental consent for minors to access family planning methods. But one of the key initiatives that we're doing to address yung restriction related to that is yung ating nakapending ngayon na pulisiya at the Senate or the Congress to ease that restriction and to make accessible family planning, especially dun sa mga mothers na at saka mga those who are victims of sexual abuse, not only in the prevention of teenage pregnancy but also ito na pag-uusapan natin ngayon prevention of HIV and AIDS infection. So hopefully hindi man siya nakapasa ngayong Congress na to, and there's little hope that uusad siya by the new Congress. Hopefully we can all support that initiative. And at the yung mga bagay na konti nating nagagawa at the local government units and even in our own capacity without the broader policy environment that we are deciding sana we are helping naman yung mga parents kasi yung parents, if they are to decide for to help decide sa mga anak nila, they also have to be empowered and they have to be educated so that they know the implications of the sexuality ng kanilang mga anak, and they can guide them into responsible sexual behavior. So that means dalawa dapat ang tinitignan natin, hindi lamang education ng mga kabataan but also education of parents so that they can properly guide them, and by that voluntarily parents na rin maggagabay sa mga kabataan for them to be able to access yung necessary family planning methods na kailangan nila. And of course sa mga facilities natin, usually ang ginagawa naman is they always provide yung health services in the interest of the well-being and health ng mga kabataan. So some health facilities natin would always see kung ano yung mas nakakatulong doon sa kabataan, lalo na doon sa pagbibigay ng mga relevant reproductive health services.
Okay, maraming salamat, Sir Boyet. And question po, for example, if you are a young person, actually dalawang prong siya, two-prong. Or if you are a young person or if you're an adult and you want to access family planning resources, where should they start po? And thank you. Who wants to answer po?
Ma'am Mai, I think I can answer this, no? So for teenagers and for young people who don't directly want to go sa ating mga health facilities, ganyan, pwede po kayo pumunta online. You can search for the Facebook page, Usap Tayo sa Family Planning, or You can also search for Healthy Pilipinas po. No? So lahat ng mga messages doon are geared for our young people in a way that they can understand and in a way that kumpleto yung information. No? So you can definitely go to those sites if you need information on sexual and reproductive health. No? At the same time, you can also go, in case you're searching online, sa Google lang, I think one of the main tips naman no, para ma-prevent po natin yung disinformation or misinformation is to always make sure na yung sites na pinupuntahan nyo ay credible. No? So yung either may mga .gov.ph, yung mga may .gov, yung World Health Organization, ayan yung mga sources na yan ay very adolescent friendly and very complete yung information. At the local level naman, if you want to go seek out information, no, if you have an adolescent friendly health facility in your area, then you can go there, no, sa adolescent friendly health facilities natin. You can also ask yung barangay health workers ninyo kung saan kayo pwede mag-approach, no? Baka sa health centers po natin ay makakahanap din po tayo ng tulong at the same time. I think Doc Jan was raising her hand. Doc Jan, do you have anything to add?
Yeah, I saw her na nag-raise ng hand about...
Yeah, sorry, I lowered my hand kasi ang pangit ng internet dito sa DOH. Pasensya na kayo. But I think Dasha already said everything regarding the adolescent-friendly health facility. So with the I Choose #Malaya Ako Maging campaign, we're really advocating for adolescents to visit our adolescent-friendly health facility. And our healthcare workers doon kasi they are really trained and they have undergone a lot of capacity building activities to understand adolescents more. So I think we have some CAP build activities on the pipeline, care of the Family Health Division. So we'll wait for it. No, ito ay mga interventions natin para mas maging friendly pa sila and they know how to communicate to adolescents who have really different needs or parang different way of communicating with them. Siguro, isa lang na point na gusto kong idagdag with the message of Sir Boyet, no, is yung EO, isa talaga yung kung bakit natin pinush yung EO because we wanted to push for the third-party authorization na hindi nagawin for the adolescents. Yan kasi yung restrictions ng RTRH law natin. So hopefully with the current bill that we have at the Senate, we can actually do away with the third-party authorization as long as our healthcare workers and even our social workers are very adept in counseling our adolescents. Thank you, Mike.
Thank you very much,
Ma'am
Dr. Yes. Sige. Cling. And then we also ask the generation side.
Yeah.
Okay, let's go.
For all our teenagers, young key population, sa ating mga bagets dyan, if you want to know more about HIV and HIV-related information and wala kayong mapuntahan dahil siguro nahihiya, for example, or walang process ng guardian sa bahay for that matter, punta kayo sa Our Safely page dahil nasa Facebook naman yung iba sa inyo. And then mag-consult tayo sa ating mga online beshies. Sobrang friendly po nila and sasagutin po nila ang mga tanong ninyo tungkol sa HIV. So wag po tayong mahiya. Punta lang po tayo sa Our Safely page and then may link po doon papunta sa ating mga online beshies. So ayan.
Aura Safely. Ayan. Tandaan natin yan. Yeah, sige, Dasha.
Before we move on to the next question, I think this is a good place also to highlight na it's not just about educating yung ating mga teenagers, but it's really about yung environment that surrounds our teenagers. So para sa mga local government units na nandito, we really encourage you to build your adolescent-friendly health facilities. Na-link na po namin yung playbook sa inyo, so please do feel free to use that and build your own CADA networks in your localities. And at the same time, syempre, ititrain din po natin yung ating mga local government officials, yung ating mga teachers, etc., on adolescent-friendly approaches. So it's very important, not just the individual behaviors of our adolescents, but even their surroundings. Do they feel safe in their surroundings? Do they feel like they're supported in their surroundings? That's very important to prevent yung ating mga risky sexual behavior. So yun lang po ang gusto kong i-highlight.
Thank you, Dasha. In terms of demand generation, we'd like to hear naman from POPCOM. Sir Boyet.
Yeah, opo. Madami po tayong ginagawa ngayon, lalo na this time of pandemic, to reach out to our different kinds of audiences, sa mga mag-asawa, sa mga kabataan, at sa lahat ng membro ng pamilya. And our website is always available for the needed information, lalo sa mga regional offices. We continue to also provide mga different information through online and virtual platforms sa local government units. And as you may have noticed, we are now converging all our initiatives with the Department of Health, mga USAID, mga development partners, kasi we felt na etong intervention na to needs the help of everyone. And as called by the EO 141 nga, it's really a whole of nation approach na kailangan natin. So baka in the future, makikita natin na all sources of information from POPCOM, DOH, and other players, even DepEd, will be converging into one. And that's what we like, para sana lahat ng mga nangangailangan, lahat ng mga stakeholders natin, not only yung mga kliyente natin diretso, mga kabataan, will be able to access needed information that they need for the promotion of the total well-being of couples as well as mga adolescents. So we hope to see that in the future, yung isang portal for everything.
Maraming salamat po also. And then, meron din po pala tayong mga sites sa Facebook, like yung Konektado Tayo for parents if you want to have sexuality education information as you discuss sexuality with your children, with your adolescent children. So pwede din po yan, no? Aside from the Usap Tayo sa family planning pages, and the DOH page, the Healthy Filipinas page, Aura Safely, and of course, meron din po yung POPCOM page na pwedeng sumagot sa inyo, sabi nga ng ating mga experts here. And then, meron na lang siguro parang last na lang.
Mike?
Yes, sir. Sige po.
Oo nga pala, kasi meron din tayo existing pala na hotline, they can also call that sa mga nangangailangan ng information, yung Usap Tayo hotline din. So, not only for teenage pregnancy but also for family planning and gender-based violence issues. So please promote that, lalo na sa mga clients natin. But hopefully, as I mentioned, all of this will be integrated na sana sa isang platform. Thank you.
Yes. Yan ang ating whole of government approach na gagawin, integrated, no? And then, sad to say, focus nowadays is on COVID, hence the establishment of adolescent-friendly health facility is not a priority. Doc Jan, ito po, maybe you want to...
Yes, sorry. I have to close my video to conserve the bandwidth. So I would just like to react, yung focus natin sa COVID nowadays. So please don't forget, everybody, that while we are having a robust COVID response, the mandate right now of the Disease Prevention and Control Bureau, as well as the other bureaus actually, is to focus on essential health services. So meron pong team for COVID-19 response, meron ding team for essential health services. Hindi po dapat natin pinapabayaan ng essential health services like maternal and child health, family planning, adolescent health, because hindi, kasi ito tuloy-tuloy at maraming tao yung nangangailangan. So kagaya po ng COVID, yung iba nating mga programa ay kailangan din magtuloy-tuloy despite the COVID-19 pandemic. Hence, gumawa po tayo ng several policies as well as interventions, and as well as we supported through cash and in-kind supports to our local government units in order for the essential health services to continue. So let's not forget, both adolescent health services and of course family planning services are essential health services during the COVID-19 pandemic. So we should promote, prioritize, and protect these health services kasi marami pong tao ang nangangailangan ng mga ating ibang programa maliban sa COVID-19. Thank you.
All right. So talagang along with the robust COVID-19 promotion and implementation, meron pa rin naman, tuloy pa rin ang mga services natin, no? So wag po tayong mag-alala. Okay. So meron po ba tayong question before we end? Okay, so I think that's it. We've entertained every question that we have, even yung mga siguro nasa online platforms natin all across our pages. Maraming salamat to our family planning experts. We have Dasha, Doc Stella, Darwin, Doc Jan, Sir Boyet, and Miss Kling and Kat. Okay? So at this point, nagpapasalamat kami dahil talagang ating hinaharp on issue for today is mag-usap tayo talaga para sa safe sex at ang pamilyang planado, protektado. Okay, so we'd like to turn this over. Maraming pong salamat. Palakpakan po natin ang ating mga family planning experts. We'd like to turn this over to my partner, Kat. Kat, over to you.
Maraming salamat, partner Mike. At ang ating FP experts na kasama natin ngayong araw, DEB Boyet, Doc John, Dasha, Kling, Doc Stella, Ma'am Elena, Sir Darwin, and of course, HPV PA6 team, sina Miss Edna Nito and Miss Riza Sumpio. Okay, now at this point po, as we continue din po yung momentum nga ng national government agencies on FP programs and HIV prevention po ngayong panahon ng COVID-19 pandemic, tayo po sa DOH at POPCOM ay nakaset ng mag-roll out ng marami pang initiatives with the aim naman to encourage more Filipino couples to seek family planning information and services. So isa nga po sa mga effort natin ngayon ay ang pagpapalaganap natin ng impormasyon tungkol sa family planning. So kasama na dito, syempre hindi mawawala ang ating television and video communication materials. Okay, to officially launch the family planning video, I am very glad to show with you po this fresh and positive approach of a video on family planning. Panoorin po natin itong video.
Buti na lang, hindi pa ngayon. Di pa namin kaya, di pa kami handa.
Hindi ka nag-iisa, kasama mo kami. Pagplano ng pamilya, ikaw ang mahalaga. Di ka dapat matakot, di ka dapat mangamba. Abutin ang gusto mo, kaya pumili na. Kaya pumili na. Pagplano ng pamilya, hawak ko sa iyong kamay. Kaya pumili na, pumili na.
Hindi na ako matatakot dahil handa na ako. Hindi na ako kabado, anuman ang marating sa tulong ng family planning. Alam kong kaya ko dahil handa na ako. Kayang-kaya mong gawin lahat ng iyong hiling sa tulong ng family planning.
Walang takot at kaba. Pag may plano, protektado.
Alright, walang takot at kaba, pag may plano, protektado. So tunay nga ang family planning ay more than just using birth control at isa siyang desisyon to take control of your life. So ayan, magandang partner. To close our event, I am turning this over to you na and to our POPCOM Deputy Executive Director, Takardon.
Ayun. So, sa tulong ng family planning, napakagandang video, no, for Usap tayo sa family planning. And to formally end this event, we'd like to call on our population and development and reproductive health expert from the Commission on Population and Development. Actually, he's the youngest ever Deputy Executive Director of POPCOM. And we'd like to turn this over to our Deputy Executive Director, Lolito Boyet Macardon. Sir Boyet, over to you. Okay.
Ay, hello. Sige.
Hear you
Okay.
na.
Sige, okay na. No doubt, we had a very productive and engaging discussion, and with the energetic and very passionate resource persons that we had. And nagpapasalamat tayo sa kanila. As you may have noticed, POPCOM, DOH, and other partner agencies that we have nowadays are very visible sa media and have been unceasingly and sustainably promoting family planning within the public discourse through the various media platforms, lalo na sa online and even in television and in the radio, lalo na within the context of this pandemic. This is basically because of the continuing challenge of having unplanned pregnancies due to restrictions in accessing family planning information and services. We all know that this pandemic has actually engendered a conducive environment for these unplanned and unintended pregnancies. For one, couples and partners are really forced to be confined within the home, which we may result to more intimate and frequent sexual relationships and activities, and even sexual violence at that. And combine that with the restrictions in mobility needed to access family planning information services and other reproductive health services, then we have indeed an enabling environment for unintended pregnancies and its concomitant consequences, including itong napag-usapan natin ngayon na HIV, AIDS infection, and at syempre yung continuing threat of adolescent pregnancies. But by human nature, as we always see, we all can always see the positives in any dark situation and problematic situation that we are in. And one of the positive opportunities for couples, partners, and even adolescents during this pandemic is the moment for deeper and more meaningful conversations with their partners, parents, and even peers. Before the pandemic, I'm sure matters about sexuality are not being discussed in those conversation. Mahirap natin mapag-usapan yung mga bagay na may kinalaman sa pamilya, sa pagpapaunlad nito, at lalo na yung mga usapin tungkol sa ating mga sexualidad. And that is why nangyayari itong mga unintended pregnancies na pinag-uusapan natin ngayon. Now that couples and adolescents are confined at home, the environment for dialogue is much more conducive because of the closer interrelationship during at homes, and given yung length of the period which we stay together with our parents and partners. Kaya inasahan natin na sana mapag-usapan ang kanilang mga balakin sa buhay, pagplaplano sa buhay, at mga bagay na makapagpaunlad sa kanilang samahan, sa kalusugan, at sa kanilang pamilya. Ang pagpaplano ng pamilya ay laging alam naman natin na nagsisimula sa pag-uusap. Ang pag-uusap ay proseso ng pagpapahiwatig ng kagustuhan at nararamdaman ng mag-asawa at pagkakaroon ng pagkakaunawaan ng magkatuwang, lalo na sa pagpapasya kung paano bubuuin at itataguyod ang pamilya. Kaya ang tagumpay ng pagpaplano ng pamilya ay talagang nakasalalay sa pag-uusap ng mag-asawa. Kaya nararapat lamang na sa selebrasyon ng Family Month ngayong taon ay bigyang diin yung kakayahan at hikayatin ng mag-asawa, ang mga magulang at kanilang mga anak na mag-usap sa mga bagay na may kinalaman sa kaunlaran ng kanilang sarili at sa kanilang pamilya. Napag-alaman natin na sa ating pag-uusap ngayon through our very energetic and knowledgeable resource person ng mga iba't ibang aspeto ng family planning, at hindi natin lang nakita yung usapin ng family planning between the concern ng mag-asawa, but we expanded that in the discourse of fertility, yung kanyang demographic implications, also yung kanyang connection with HIV/AIDS, and of course dun sa adolescent pregnancy. So malawak yung usapin ng family planning as we have seen, and we have been provided with a lot of tools na kailangan natin na pwede nating magamit, lalo na sa local government units, particularly within the context of the full devolution na tinatawag natin. Ang hamon ng pag-uusap ay hindi lamang sa pagitan ng mag-asawa o magkatuwang or even parents and yung kanilang mga anak or children. Kasama rin dito ang paghihikayat sa ating lahat na makipag-usap sa ating mga service providers upang makakuha ng tamang impormasyon na maaring magamit sa ating kalusugan and even sa pagpaplano ng ating pamilya. Iwasan dapat natin yung magdesisyon base sa mga impormasyong nakukuha sa internet, sa ating mga barkada at iba pang hindi mapagkakatiwalaang sources. And that's the challenge of that's the call of today's activity, to engage more with persons na makapagbigay ng tamang impormasyon at malayo tayo sa kapamahakan. At kaya wag basta-basta magtiwala sa ating nakukuhang resources at sa mga different outlets na sa tingin natin ay makakapasama sa ating condition. So mas mainam na makipag-usap sa mga professionals and service providers. So that's one of the key messages that we had today. And lastly, the call for usap tayo ay naghihikayat din sa mag-asawa sa ating lahat bilang na maging isang advocates, hindi lamang sa family planning but also yung very important message on the prevention of HIV and AIDS and even yung adolescent pregnancy. Magandang tool ang ating karanasan, ang ating karunungan para mahikayat ang ating mga peers, ang ating mga anak and mga family members and even our partners to practice and to access relevant family planning information and services. So the call of Usap Tayo is also a call for us to be more active advocates sa iba't ibang platforms na kaya natin sa ating sariling perhaps sa mga Facebook accounts at sa mga pagkakataon na tayo ay nagipag-usap informally sa ating kapitbahay and mga kumare, mga kumpare. So all of the people that we are engaging with, maaari tayong maging instrumento ng mga mensahe na maaaring makatulong din sa kanila. At pag-usapan natin yung mga bagay na sa family planning at mga bagay na makakapagpaunlad sa kanilang sarili. So at this point, on behalf of the organizers and DOH, Filipina Shell Foundation and USAID, we'd like to thank all of you who have participated in this very engaging and meaningful activity. I've read doon sa chat box your appreciation of the information and insights that you have learned today. Hopefully they can be translated into more concrete action to support this initiative. Siyempre, pasalamatan nating lahat ang ating mga very able resource persons from DOH, mga rising star na tinatawag nila, and the Filipina Shell Foundation, lalo yung mga Protects Project na nagbigay sa atin ng information on HIV/AIDS in relation to family planning. And we'd like also to thank our partners from various national government agencies na nag-participate ngayon, mga representatives from the civil society organizations, development partners in particular, with USAID through the Richard Project and lahat pa na sumusuporta sa mga family planning program ng DOH and POPCOM or the entire government agency for the technical support. And syempre mga participants from our local government units, kayo ang pinaka frontliner natin ng family planning program. That's why we also appreciate your attendance today. At mga regional agencies din natin, nalimutan ko ang banggitin din, hindi lang mga national but mga regional government agencies na nandito ngayon. Maraming salamat sa inyong pagdalo at lalo na yung mga kasamahan natin from, as I mentioned, local government units, from health and population officers and other workers from the different local departments. And lastly, I'd like to thank the public in general who have supported this, lalo na sa Facebook Live natin and even dito sa Zoom natin na sumubaybay hanggang ngayon para sa ating napakagandang event na to. Sana nakapulot tayo ng mga impormasyon na maaari nating magamit sa araw-araw na pamumuhay natin. So sa ating lahat, ipalaganap natin ang pag-uusap tungkol sa pagpaplano ng pamilya tungo sa masayang pamilya para sa Healthy Pilipinas. Magandang hapon sa lahat.
Ayan, palakpakan natin ang aming Deputy Executive Director, DED Boyet Tacardon. Maraming salamat, Sir Boyet. Lahat ng aspeto ng buhay natin ay nag-i-involve talaga ng pag-uusap. Kaya tayong lahat ay merong opportunity to make a difference. No, tayo ay mag-usap para sa family planning, para sa safe sex, no? And also we would like to take this opportunity to invite all of you. Sinend ng aking magandang partner sa Zoom chat box ang link to our Linggo ng Kabataan press conference. It's a partnership between DOH, National Youth Commission, and POPCOM. So you are invited po to this event. And also i-announce na rin natin, Partner Kat, na meron din tayong partnership with the Department of Education. So kasama po tayo, kami, DOH, POPCOM, doon sa Comprehensive Sexuality Education, Adolescent Reproductive Health Convergence ng Department of Education on September 9 to be aired also live across all online platforms in DepEd, DOH, Healthy Pilipinas, and POPCOM Facebook pages and the Usap Tayo sa Family Planning Facebook pages. Ayan, maraming salamat. Usap tayo, Partner Kat. At nagpapasalamat ako kasi lagi tayong nag-uusap. Partner Kat, over to you.
Maraming salamat, Ma'am May. At salamat din po sa pagdala sa ating event ngayong araw. Ang Usap Tayo, kasama ang ating FP experts, a joint dialogue of DOH and POPCOM. So bago po nating tuluyang i-end ang ating usapang family planning at iba pa, makikita rin po sa Zoom chat box natin ang link para sa ating evaluation sheet. So lahat po ng mga ka-fill out ng ating attendance and evaluation sheets ay makakuha po ng ating certificates. No? At syempre po ngayong araw din, may ipapakita lang din po kami. Ayan. Ngayong araw din, no, August 18, Masayang Pamilya at Healthy Pilipinas, mayroon din tayong Lazada flash sale up to 50% off. Dahil ngayong Agosto nga, no, ay Family Planning at HIV Prevention Month. So laging tandaan sa pag-aura ng safe, may choices ka. So last hour safely for a healthy Pilipinas. Mamay!
Yes! So, mga kapatid, let's aura safely. No, yan ang ating mensahe. At lagi tayong mag-usap para sa HIV-free Pinas, para sa safe sex, at para ang pamilyang planado, protektado. Ito po ang inyong mga naging hosts sa araw na ito, Masayang Pamilya. Ito po si Mai Kiray from the Commission on Population and Development. Kasama ang aking laging kausap sa mga panahon nito. Partner Kat.
Ako naman po si Kat Vitog ng Health Promotion Bureau ng Department of Health. So Mamay, sama-sama tayo, masayang pamilya para sa Healthy Pilipinas. Maraming salamat po.
Ayan, masayang pamilya. Gusto na rin, no? So at this time, we'd like to request everyone to please open your cameras. No, so we can have a photo op. Sayang 263 na lang tayo. Kanina we were almost 500. But at least we all stayed and we all really gave our time and our effort para sa ating mga kabataang Pilipino. So please open your cameras and let's have the finger heart as we end the National Family Planning Month, our culmination of our partnership. Maraming salamat DOH and POPCOM. Ayan. So please open your cameras. Partner Kat, ikaw ba ang mag-take ng photo?
Yes, Partner Mai. So meron tayong 4 pages na naka-camera ngayon. Pero 11 pages siya. So smile lang po. Okay, ayan. First page. Finger heart. 1, 2. Okay.
Ang relationship para sa family planning.
First page. Finger heart po. Ayan. Happy Family Planning Month. And HIV Prevention Month.
Ayo.
Third page po. Finger heart. Smile. Next page po. Next page po. Ayan, Mamay. Mukhang okay.
Yay! Finally, okay na. Actually, bago tayo mag-end, partner Kat, meron ding suggestion dito si Christine May Balagot. Sana next time pag may similar webinar po ulit, ay directly invite ang mga sungguniang kabataan members to join through the provinces. Napakalaki na maging contribution nila as peer educators. Wag po kayo mag-alala kasi kapartner na po namin, no, partner Kat, ang ating National Youth Commission. Alright? So maraming salamat po muli. Ay ni-invite po namin kayo muli sa ating event tomorrow for Linggo ng Kabataan, culmination in partnership ng Department of Health, National Youth Commission at POPCOM para sa Linggo ng Kabataan press conference. Yung pong link ay nandito. And again, maraming salamat. Partner Kat, pagpasalamatan natin ang ating mga kasamang division, no? Siguro I'll turn this over to you muna para magpasalamat sa mga taga-DOH and then I'll thank mga taga-POPCOM. Partner Kat, sino papasalamatan natin?
Thank you, Ma'am Mai. So, pinapasalamatan ko syempre ang Health Promotion Bureau, Company Strategy and Management Division, Program Implementation and Outreach Division, and of course, Capacity Building and External Relations Division. So, kasama natin si Ma'am Edna, si Ma'am Riza, si Kling, si Dasha, and of course, ang ating DOH Office of the Secretary Communications Management Unit. So, kasama natin Sir Glenn, Ma'am Krisha, and Sir Jazz.
Ayun. Sa akin naman, nagpapasalamat kami sa Information Management and Communications Division, Miss Susan, Grace, Riza. Ang dami kasi nila, Michael, Kevin, Irish, Don, Sam, Mike Policarpio, our media specialist. Sana wala akong nakalimutan. Maraming salamat from the Office of the Executive Director, Aiba, ng ating Forever Tech person. Thank you very much. And we'd like to thank the project management team, Roy, Dom, nandito sila ngayon. And of course, the Office of the Executive Director. Maraming salamat. Nandito si DED Boy Takardon. Lahat ng aming regional directors, assistant regional directors, executive committee members, at lahat ng POPCOM officers and staff. Partner Kat, maraming salamat.
Kaya pinapasalamatan ko din ang ating regional offices, no? DOH Regional Office. And of course, ang DOH Disease Prevention and Control Bureau, Doc Jan, Ma'am Abby, Ma'am Dulce, Doc Jigs, and sana wala rin po ako nakalimutan. Sir Ken, of course, and Ma'am Hazel Chua. Ayan, thank you very much po.
Ayan, so para sa isang masayang pamilya at healthy Pilipinas, magandang araw po sa ating lahat and God bless us all and happy National Family Planning Month even sa aking partner. It is again a pleasure being with you.
Thank you, Ma'am.
Tayo ulit bukas. Okay. God bless. Bye. Join us tomorrow po.